Welcome back to my YouTube channel. Today we are going to discuss an important topic, iron deficiency anemia. Iron deficiency anemia occurs when there is an insufficient amount of iron in the body to support normal hemoglobin synthesis. Since iron is essential for the production of hemoglobin, iron deficiency can lead to reduced hemoglobin level. Typically, iron deficiency anemia is a microcytic hyperchromic anemia, meaning that the red blood cells are smaller than normal and contain less hemoglobin. Now, let's talk about the amount of iron present in the body. A newborn has approximately 0.5 gram of iron, whereas normal adult has approximately 3 to 5 gram of iron in the body. Next, let's discuss the dietary source of iron. Iron is found in both animal and plant based foods. Good sources include meat, liver, egg, green leafy vegetables, and fruits. Now, let's discuss the etiology of iron deficiency anemia. The major cause of iron deficiency anemia can be broadly classified into four categories: increased blood loss, increased iron requirements, inadequate dietary intake, impaired absorption of iron. Let's discuss this cause in more detail. First, we can discuss increased blood loss. Iron deficiency anemia can occur due to acute or chronic hemorrhage. It may occur in the conditions such as abnormal uterine bleeding, bleeding from peptic ulcer, hook vein disease, and trauma. Second cause is increased iron requirements. The body requires more iron during certain physiological conditions such as pregnancy, lactation, and adolescence. During adolescent period, iron is needed to support rapid growth and development. Third one is inadequate dietary intake. Iron deficiency can also result from the insufficient intake of iron in the diet. This may occur due to poverty, poor dietary habits, anorexia nervosa, loss of teeth, which can make it difficult to consume an adequate diet. Fourth etiological factor is impaired absorption of iron. Even when a person consumes adequate amount of iron, but certain gastrointestinal conditions can interfere with iron absorption and eventually lead to iron deficiency anemia. Now let's discuss the clinical presentation of iron deficiency anemia. First, we will discuss the oral manifestations. In the oral cavity, patient may develop angular cheilitis, which means cracks or fissures at the corner of the mouth. The tongue may become swollen, smooth, and sore. This condition is also known as glossitis. Another clinical feature is pica, which refers to an unusual craving for non-nutritive substance such as ice, dirt, paint, or starch. There is other several systemic manifestations are included, that is pale skin, headache, fatigue, dizziness, chest pain, tachycardia, shortness of breath, and spoon-shaped nail. Then we can discuss the management of iron deficiency anemia. The main treatment option is iron supplementation, which is available in form of tablet, capsule, or syrup. Now let's discuss the adverse effect of oral iron therapy. This include nausea, epigastric discomfort, constipation, and black or dark colored stool. Moreover, there are some important precautions to keep in mind while taking iron supplements. First, avoid taking multivitamin tablet with 2 hours before or after taking an iron supplement. Second one is avoid taking antibiotics such as ciprofloxacin, doxycycline, levofloxacin, and tetracycline at the same time as iron supplements. In addition to that, avoid taking antacid at the same time as iron supplements. Advise patient to take antacid at least 2 hours before or after taking the iron supplement. This is a short video about iron deficiency anemia. Please watch and subscribe my YouTube channel. Thank you.